Hello, my name is Emily Storey, and today I'm presenting on sex addiction's sociological analysis. To start, it's important to frame this discussion within the broader concept of sexual health. The World Health Organization defines sexual health as a state of physical, emotional, mental, and social well-being in relation to sexuality. It is not merely the absence of disease, dysfunction, or infirmity. Sexual health requires a positive and respectful approach to sexuality and sexual relationships, as well as the possibility of having pleasurable and safe sexual experiences free of coercion, discrimination, and violence. This definition stretches well-being over dysfunction, a key distinction when we explore what counts as unhealthy or too much sexuality. So, what exactly is sex addiction? Medically, sex addiction can be explained, but is not currently an official diagnosis in the DSM-5. Instead, the DSM-5 includes related disorders such as compulsive sexual behavior under the categories like impulse control disorders. Sociologically, sex addiction can be seen as a product of medicalization, a process defined by Peter Conrad as the process by which non-medical problems become defined and treated as medical problems, usually in the terms of illness and disorders. This process can reframe social behaviors, such as high sexual desire or non-normative sexual activity, as clinical conditions. In the DSM-5, hypersexuality, or sex addiction, is not recognized as its own independent category. The APA declined to include it due to the concerns about the lack of sufficient empirical evidence and the potential for overdiagnosis, according to Roger 2021. However, it is sometimes diagnosed as a subtype of other specified sexual dysfunctions or impulse control disorders not elsewhere classified. In contrast, the ICD-11 developed by the World Health Organization does recognize compulsive sexual behavior disorder, also classified as CSBD, as a diagnosis under impulse control disorders. It defines CSBD as a persistent pattern of failure to control intense, repetitive sexual impulses or urge, resulting in repetitive sexual behavior. World Health Organization 2022. This difference highlights an important tension between American psychiatry and international classification systems. Recent articles like Rogers 2021 from CNN report that many people experiencing hypersexuality feel out of control and distressed. Yet, medical professionals remain divided. One article by Dexter explains that hypersexuality is defined as an obsessive urge to impulse to engage in various kinds of sexual activity, including excessive masturbation or use of pornography, sexual thoughts, urges, or behaviors that can have negative consequences when a person is preoccupied with them. Still, others warn against labeling sexual desire as disordered, especially given moral, cultural, and religious biases. Medicalizing sex addiction can come with different pros and cons depending on the situation. On one hand, it can help people who feel overwhelmed and out of control to seek treatment. It gives legitimacy to their experiences. George Cobb, director of the U.S. National Institute on Alcohol Abuse and Alcoholism, supports this, arguing that labeling addiction as a brain disease could reduce stigma and encourage treatment. On the other hand, a debater, Mark Lewis, a neuroscientist and author, disagrees. He argues that calling addiction a brain disease leads people to feel helpless and may reinforce the idea that they are broken. He sees it instead as a serious behavioral issue. This debate shows that the label of addiction can shape treatment, self-perception, and public opinion. Regarding this in sex addiction, it could be one of both ways. Somebody may feel that they have their life out of control due to their sexual impulses. On the other hand, someone may be comfortable with their sexual impulses and just see it as another aspect of their life. Sex addiction is also tied to the concept of pathologization, the process of framing something as a disorder or a disease, very similar to medicalization. This relates to the Thomas theorem, a key sociological idea that says, if people define situations as real, they are real in their consequences. If society defines hypersexuality as a disease, then people who experience it may internalize this identity and be treated accordingly, even if the criteria are vague or culturally biased. The biomedical model sees sex addiction as a malfunction, often located in the brain or an impulse control system. This leads to treatments like cognitive behavioral therapy, known as CBT, medication, or group therapy. In contrast, a sociological perspective considers the role of norms, values, and culture. It asks, what makes a sexual behavior too much? Who defines what is healthy, and who benefits from those definitions? Science often presents itself as objective, but its interpretations are shaped by moral and cultural norms. For example, how often do people really have sex? Is it different in the Western world compared to around the other world? The answer is yes. What about what makes a sexual relationship healthy? What is considered too much? These are all things we have to consider when looking at sex addiction from a sociological standpoint. Shame plays a huge role in how sex addiction is experienced, particularly along gendered lines. Men are often stereotyped as being consumed by sex, while women are expected to be pure, keeping in mind that this binary is the predominant narrative in Western society. When women express strong sexual desires, they are often seen as deviant. This reflects Amelia Durkheim's concept of anomie, where the breakdown of social norms leads to personal disconnection and deviance. We also see hegemonic masculinity, a term coined by R.W. Connell, where the most culturally honored form of masculinity is dominant. Heterosexual and emotionally stoic are often unattainable. When men deviate, they're sometimes seen as victims of addiction. But when women do, they're labeled immoral. Meanwhile, hybrid masculinity, as defined by Bridges and Pascoe, allows men to selectively adopt feminine traits or elements from marginalized masculinities without losing social power. Relating this to the idea of sex addiction, one can be seen as a sex addict way more easier as another depending on their group identity, whether it be their gender expression or how open they are about talking about these things. So when it comes to defining these concepts, there has to be an understanding of gender imbalances and narratives when it comes to sex in our society. Sex addiction diagnosis can reinforce heteronormativity, the assumption that heterosexuality is the norm. Jackson, 1999, defines heteronormativity as the normative status of heterosexuality, which renders any alternative sexualities other and marginal. As Farrell and Cacchioni note that heteronormativity makes penile penetration the only real sex. This means that LGBTQIA2S+ people, especially those with high or non-normative sexual desire, may be disproportionately medicalized or stigmatized because they do not follow this idea of heteronormative sex or ideas of what sex is supposed to look like in a heteronormative society. Sociogenic and culture-bound considerations. Could sex addiction be sociogenic, that is, socially caused? Could it be socially constructed, meaning it only exists because we've created the category? Could it be culture-bound, a disorder only recognizable within Western values and ideals? These are open questions, but they highlight how our understanding of addiction is shaped by where we live, what we value, and how we relate to sexuality. Finally, being labeled a sex addict can carry heavy stigma. It may cause shame, affect relationships, justify discrimination, or prevent people from exploring healthy expressions of sex. Sociology reminds us that labels matter. As we consider how to define, treat, or even name sex addiction, we must ask, who benefits, who is harmed, and what alternatives exist? In conclusion, sex addiction is more than a medical condition. It is a social issue, a cultural narrative, and a deeply personal experience. Recognizing its complexity helps us avoid shame based on overly simplistic approaches. It also invites us to rethink what it means to be healthy or normal in a world where sexual norms are constantly shifting. Thank you for watching.